Thank you all for joining us tonight. We are here to talk about, and I hope you're in the right webinar, we're here to talk tonight about the Bachelor of Science in Health Information Management that is offered by the City University of New York at the School of Professional Studies. This is a completely online degree, and this evening we hope to give you a lot of information about the program and about the college. And in return, at the end, if you have any questions, please use the question chat feature to write your questions. We won't stop in the middle of the presentation to answer them, but we will take your questions at the end. I hope to, and I hope we won't go over an hour out of respect for your time. So go ahead and ask questions and we'll get to them at the end. So let's get started. And a little bit about me. This is me, Ellen Carl. I am the academic director of the Health Information Management program at the CUNY School of Professional Studies. So I've worked in the HIM field for a little bit of time. I have quite a bit of experience working in health information management. I have a degree in health information management in addition to an MBA with a concentration in health administration. And I think if you look at the schools I went to, you might think, oh, I guess she's from Florida, but no, I'm really from Long Island. That's where I grew up and went to high school and whatnot. And then after 2 years of college, I transferred to the University of Central Florida because they had the HIM program that I was looking for. Most of my career I spent working as a health information management department director at different hospitals in Florida, New York, and New Jersey. I was, my experience is really relegated to the acute care hospital setting. And probably about 10 years ago, I left the hospital setting and got into academia. And I worked at a community college for a while in New Jersey, and now I'm working at the CUNY School of Professional Studies. This is my 5th year there, and we have a great program here at SPS. I'm also a very active member and volunteer with the American Health Information Management Association. This is the professional association that that sort of governs our program. We adhere to the curriculum competencies that are requested by AHIMA and that are thought that professionals coming out of HIM programs, they should possess those competencies. So if you're not familiar with the American Health Information Management, their email, their website is ahima.org. You really should take a look there and really scout out their website for all the information there is about a profession and a career in health information management. So now I am going to turn this over to my colleague, Janet Molenhoff, who is the other full-time faculty member at in our program at the School of Professional Studies. So Janet, take it away.
Sure. Hi, everybody. My name is Janet Molenhoff, and I also have over 25 years experience working in the field of health information management. I have worked in long-term care. I've worked in a clinic for the developmentally disabled, and I've also worked in acute care. I have a master's in public administration with a concentration in healthcare from Alfred University. And I also have a bachelor's degree in health information management from SUNY Downstate. So I'm a total New York girl here. I also am an active member and volunteer with the American Health Information Management Association that Ellen mentioned, AHIMA, as well as the NIHIMA, which is the state association, and HIMANIC, which is the New York City local association. So there's many different levels of associations. So, okay, that's enough about us. We're going to actually talk about what is the field of health information management? So the next slide really gives us the official definition. It's the practice of acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality patient care. So what does that really all mean? And what do you have to know in order to be this health information management professional? So next slide, please. This slide shows you what types of things you need to study. Really, health information management sort of sits in between the clinical side and also the technical side of a healthcare organization. So we really have our feet in both camps there. We have to know about information governance. How is all this information stored? Where is it stored? How can we access it? Can we access it? If it's old information stored in an old computer system, how is it stored there? Can we access it still? Information protection. I'm sure a lot of you in this day and age of identity theft understand why their information needs to be protected. This is highly confidential information that is in a healthcare organization. So we have to know about all the regulations and laws that govern protecting information. Informatics, again, is that technical piece. We have to know how that electronic health record works. You know, I'm sure many of you have had some exposure to some sort of electronic record. So many more healthcare, most hospitals now have at least some sort of electronic record, and many physician offices also have an electronic record. And with all that data that we're collecting now electronically, we need to analyze that data and use that data. So you also study about data analysis. How do you analyze the data? Revenue management is another important aspect. So we need to be very well versed in coding, and with that coding, there's also compliance issues, as I mentioned before, with the protection of data. That's also compliance with HIPAA. And then, of course, leadership. We do assume a leadership role in these different healthcare organizations. So next slide, please. So once you graduate from this program, we are a CAHIM accredited program, meaning that we follow all the competencies that are required by the accrediting organization, which is CAHIM, and this leads you to be eligible to sit for the RHI credentialing exam. This is the Registered Health Information Administrators exam. This is a very highly sought out, credential out in the healthcare industry. So the next slide tells us about what really does an RHIA do. Well, again, as I mentioned, we really provide that critical link between the provider, the payer, the patient. We interact with all these different departments. We really see how the information flows throughout the whole organization. The old term for this field was medical records, but it's so much more than just medical records. We're looking at those computer information systems, and again, as I mentioned, we're collecting data, we're analyzing all that patient data, and we're using those different classification systems such as ICD-10-CM and ICD-10-PCS and CPT. And we also need to know all that medical terminology, because you cannot begin to even apply any codes unless you understand the terminology and the disease process. So as I mentioned, we have to have that clinical knowledge as well as that administrative knowledge. We need to apply ethics and legal requirements, because the healthcare industry is highly regulated. There's so many different standards and regulations that we need to follow, and we need to know what all of those are. And again, the privacy of protecting that patient information. We really are, the protector of that patient information. We also oversee the people that work in the health information department, that operational unit, and we participate in many different administrative committees within the organization. And we also have a financial piece. We have to be able to prepare the budget for the department. So once you get this RHIA, what do you actually do? Next slide is going to show us what we actually do. Can we skip to the next slide? Okay, good. Okay, so these are some of the career options for graduates. These are some titles that you might see out there if you go to any of the different, search engines that for jobs. If you search for health information manager, that RHIA credential, even if you just search for RHIA, you'll see some of these different titles will pop up. The health information manager is a traditional role where we oversee a different an area of the department, or a health information director would be the director of the entire department. Again, clinical data analyst, I talked about all that data that we're generating now with that electronic health record. So we need to analyze that. Implementation support specialist. Again, most organizations either have an EHR, electronic health record, already implemented, or in the process of implementing the full record, electronic health record. So that might be a position that an RHIA would hold. A DRG validator. This is someone that goes in and makes sure that the coders have coded correctly, and they're validating that the work was done, and we're not overbilling or underbilling for, overcoding or undercoding. Revenue cycle auditor, again, will also look at that whole revenue cycle process. Down the bottom there, you see that hicareers.com. If you get a chance, that's a really great website. They have this career map that sort of shows you all the different areas that you can we work in with that fall under the health information management umbrella, and they show you what an entry-level position looks like, and what skill sets you need to progress up that career ladder to the higher or advanced levels of health information management. So I'm going to turn this back over to Ellen now, and she's going to talk a little bit more about our specific program.
Okay, great. Thank you, Janet. A BS in Health Information Management. Most places it require, including at the CUNY School of Professional Studies, you need to earn a total of 120 credit hours for the degree. In those 120 hours, you will have 39 credits in the general education curriculum, 75 credits in the major, and you will have 6 free electives. So here again, as far as HIM student resources are concerned, here we're going back again to ahima.org, which Janet and I have both mentioned today. So if you're unfamiliar with the organization, you really should check it out. It's where you're going to find a great deal of information about the profession and the field, as well as that great career map. And there also is a career and student center on the website. So we highly encourage you, of course, to check it out. In addition, there's a brochure that was created by the New York Alliance for Healthcare, and it could be found here. When you get the slides tomorrow, you can click on this and you can find the brochure. It does a great job of outlining what the field of health information management is about. So what does it take to be an online student? I'm sure some of you have dabbled a little bit in online classes. Some of you, like when I was in college, didn't even have a computer. But so those of you who've dabbled a little bit, so some of this might be familiar to you, but this is what we think is most important, and that is time management. It is crucial that you're able to manage your time appropriately in online classes. It's just in an online class, it's just not enough to quote unquote show up. So if you're taking a face-to-face class, and perhaps you had a really late night before, you had to work later than you expected, and you're exhausted, and you get into class, at least you're there and you might be listening to something, or you get credit for being in the classroom. It doesn't really work like that when you're an online student. You really need to be there and participate. And your participation in what we have called discussion boards is really one crucial part of the course. So time management really goes hand in hand with discipline. You need to we even suggest that you students schedule yourself your time, so that you know that perhaps Tuesday night you're going to spend 3 hours in the evening working on your medical terminology course. So guess what? Put it on your calendar. We suggest that you block time off and not let anything interfere, so that you have like an appointment with yourself to work on your medical terminology class. Some students find it helpful to schedule, they know like on Tuesdays they work on one class and Thursdays they work on a different class. But they just know, what they're going to need in that class once you get going. We do suggest, and we've done some internal studies on this, that for every course you take, you can expect to spend between 9 and 12 hours a week on one class. So as you can see, if you take 4 classes, which we do not recommend to start, but if you do take 4 classes and we're going to estimate 10 hours a week for each class, you can tell right away 40 hours, that's another full-time job. So it really is a huge commitment, and you really need to manage your time wisely to be successful. And getting back to our platform, some of you, as I mentioned, probably use this if you've recently been in school, especially in CUNY. CUNY's online platform or learning management system is called Blackboard. And we do have a wonderful orientation program for Blackboard that starts two weeks before the beginning of a semester. It is highly suggested that you complete this orientation so that you're ready to go on the day classes start, and you do not have to spend the first 2 weeks of your courses being oriented to Blackboard. So Blackboard is our learning management system. So what does an online course look like? This is actually the inside of one of our courses in HIM 202, Introduction to the Health Information Management Profession. So when you log in, you will see something like this with announcements. This is just a little snippet of what the actual page would look like in your computer, but you might have an announcement from your professor that day saying, here's an interesting article in the news about health information management, or don't forget to take your exam that's due on Sunday. Any sorts of announcements that is helpful for the professor to communicate with the students. If you look down the left-hand menu here, you'll see that this is an actual menu from the course that was offered in the fall of 2017. So here's, if you would click on announcements on the left-hand side there, you'd come to this page that you see here. We also have something in all our classes called Start Here. It's a little mini orientation to what's going to happen in this particular course. You could click on the syllabus to see what's in the syllabus, and of course read the syllabus and make sure you download that. There's weekly folders, there's a discussion board, assignments, a place to check your grades, a place where you can find out who your professor is. You should know that after about the first couple of days. So anyway, a lot of helpful information. All these things on the left-hand side can be clicked on and to find what you need to do for the week. Here is what the inside of a weekly folder looks like, and all of our courses are set up with weekly folders, so you know what you have to do in any given week. So this student clicked on in the left-hand side menu on weekly folders, and this is what we came up with. So this is really the beginning of the course, and you can see here there's a short description of what you're going to talk about in this module, what the learning objectives are for this module, what the reading is, discussion, what the discussion board is, and this kind of got cut off a little bit here. But if there's an assignment, it might list also what the assignment is. And if you have a quiz, it'll tell you that here as well. So everything is laid out pretty well for you. And so you have an idea of when the course opens for the week, you'll have an idea that week what you're going to be expected to do. But in fact, if you had downloaded the syllabus, you might have a good idea also of how much work is going to be due in a given week. Okay, let me continue. All right, well, let me just say another thing. I'm going to go back to this other slide, a little bit more about our courses. So sometimes people have the impression that an online course is extremely flexible. So let me put it this way. Online courses are flexible, but they are not a course where you can do everything at your leisure. So, from start to finish, you can't do that in our online courses. In our online courses, the material is set up in weekly increments. So in this particular thing that's on the screen, there would have been so it might have opened on Monday at 12:01 past midnight, 12:01 a.m. And then come Sunday night at 11:59 p.m. Everything that you had to do in that given week should be completed and submitted. So the overwhelming majority of the courses at the School of Professional Studies are set up this way. So it is online, it is flexible because you can do it any day of the week that you would like. You can do it any time of the day that you would like during the week. You could do it 3 in the morning. If you worked a 3 to midnight shift and you come home and you're going to do work, then the course is wide open to you at that point. The only thing that is required is that you complete all the work by the given deadline. The faculty members usually have a set day. As I mentioned Monday to Sunday. Some people have their week start on Thursday and end on Wednesday night. So it depends on the professor and their preferences. But there are weekly deadlines in every course. So why should you choose CUNY SPS for health information management? Well, we are part of the City University of New York, which I mentioned earlier, which for those of you who might be out of the area, the City University of New York is a 24 campus university in the 5 boroughs of New York City. So there's wonderful opportunities for growth and upgrading knowledge and whatnot. We are accredited by the Middle States Commission on Higher Ed. So if you're looking at other colleges, I would just caution you that wherever you're looking, make sure your college is regionally accredited by a regionally accredited institution such as Middle States. This is very important. This demonstrates that the college has met all of the necessary requirements by the commission. And that your credits will be then fully transferable to any university if you wanted to continue on, say, for a master's degree, or even if you wanted to go back and get a second bachelor's degree. Any credits earned here at the City University of New York will be fully transferable to another regionally accredited institution. This is a really important thing to look at these days. There are 5 regional accrediting bodies across the United States. So depending on where the college is, we'll make a determination, which state it is in, we'll make a determination as which accrediting body will accredit that particular college. Recently, we were ranked 16th in the nation in the U.S. News and World Report's 2018 list of best online bachelor's degree programs. And we're pretty proud of that. We're ranked in the top 5% of all ranked institutions. So who are our students? Well, we like to say students are people just like you. And the reason we had this 8 p.m. Webinar was a couple of reasons. We know that we attract students from across the country, and there are different time zones in the country. So maybe you're from a different time zone. However, we also know that most of our students are working adults, many in career transition, and we want to make sure that, you know, we're accommodating you. So most of our students are working, most of our students have families of their own, and you need a degree that fits into your schedule. And as I mentioned, yes, online courses are flexible. So we know that you do need to fit in your coursework into your schedule, and that so that you can be successful in the end. And as I mentioned, we do have people from across the 50 states and from around the world. Actually, our average student is around 35 years old and is female. We have an overwhelming majority of females in our School of Professional Studies, and the average age is 35. So who are our faculty? So you met Janet and myself. We are knowledgeable HIM professionals. We also have many adjuncts who are knowledgeable practitioners who are currently working out in the field. Their full-time job is that they work in HIM. And we do have faculty also from all over the country. We also have some experienced CUNY faculty, and all of our online faculty have to go through a training to be an online instructor, and have all gone through that training and are skilled at teaching students online. So what about student services? So we have a career services department to help you out. If you do decide to apply and are accepted, the next step is you would be assigned to an advisor. All students are assigned to an advisor, and that advisor sticks with you from start to finish. So it's really helpful to have one contact person to work with throughout your journey with the School of Professional Studies. We do have tutoring, both online and in person. We also have a library that's both online and in person. We work with the Baruch Library, which is another one of the CUNY schools in New York City in Manhattan, not too far from our campus. We also participate with an online library service that you know, they're available 24 hours a day, 7 days a week. I actually tried it one day, I think on a Saturday night. I was looking for something. So yes, they're there, and somebody can help you and point you into the right direction, We also have a help desk for any technical type issues that you might have. So some frequently asked questions, and and I know that probably many of you, maybe some of you already put these in the chat boxes, I don't know, but can you really earn your degree online? Yes, absolutely, you absolutely can. And number two, is your school accredited? Well, I kind of went over that before, but in addition to accreditation by middle states, we are also accredited for our health information management program, which, as Janet mentioned, allows students who graduate from our program to sit for the RHIA exam. That is the only way that you can sit for the RHIA exam, is to graduate from a CAHIM accredited HIM bachelor's degree program. So how long will it take to get my degree? So I guess I have a few things to mention here. Firstly, we haven't mentioned it thus far, but our school is considered to be a degree completer school. So anyone who applies to our program, and everyone in our HIM program, as well as all the others, are considered to be transfer students, because you must have 24 college credits in order to be eligible to apply. So you have to have earned 24 college credits somewhere else. We really don't care what they're in. Doesn't have to be in HIM or HIT. You just have to have 24 college credits. And in those 24 college credits, you have to have a GPA of 2.5 or above. So that's 2 of our admission criteria. In addition, you have to be proficient in math and in English. And usually the way the students demonstrate proficiency in math and or English is by taking a college level English or math course. So again, getting back to how long will it take to get my degree? So it really depends. If you come to us and you transfer in 24 credits, you have to get up to 120 credits in order to get the degree. However, we can transfer in up to 90 credits. And occasionally I do have students who transfer in 90 credits. So that means you have to do 30 credits in residence at the School of Professional Studies. So if you ask me how long it might take for you to finish if you have 90 credits, well, it's a different story than if you're transferring in only 24. But the thing that really makes the decision yours to determine how long it's going to take for you to get your degree is how many courses you're willing to take a semester. Are you going to take 2 or are you going to take 3? Certainly if you take 1, it's going to take you a lot longer to get to the finish line. Another thing that is you can take into consideration is that we do offer courses over the summer. So you have to make a decision, do I want to get 1 or 2 out of the way in the summer? And we also have a really short winter session in January, which is 3 weeks long and very intense, to take a 15-week course in 3 weeks to get the same number of credits. But we do offer a smattering of courses during that semester as well. So really the decision about how long it takes is up to you. Depends on how, what time you have, how you can fit it into your schedule, and how many credits you're transferring in. So the last question here, because I think I answered all the other ones, is do you give credit for life experience or prior learning? Well, we do have a fairly robust prior learning program at our college. However, just a word of caution, it's not like you can give us your resume and say, okay, here's my resume, please give me credits for whatever I have written down on there. So it's not that simple. However, we do have ways for you to demonstrate your life experience that you've earned thus far. There is a course that you could take, and then you have to create a portfolio to demonstrate that you have already the knowledge to meet the learning outcomes of a given course. And you can create several portfolios in order to do that if you have extensive knowledge in the field. You can also take CLEP exams. There are other exams, challenge exams that you can take. Or if you've earned credentials, for instance, from HEMA, if you have credentials already, we give credit for those credentials that you've already earned. So if that applies to you, certainly reach out to us, or when you apply, make sure you write something about that in your essay. And that's another thing I didn't mention. So in addition to having 24 college credits and a 2.5 GPA, you do need to write a short essay about why you would like to be in this HIM program. So if you have any credentials, be sure to include that in your essay. So I did an awful lot of talking. Here's my contact information, as well as contact information for our Director of Admissions, Lucas Fuentes, and Felix Huertas is our financial aid guru. So feel free to reach out to any of us, and we'll be happy to help you or answer any questions that you might have regarding the School of Professional Studies, or if you have anything specific about the Health Information Management Program, definitely reach out to me or Professor Molenhoff, and we'd be happy to take your questions. So Janet, did I miss anything?
The only thing that you missed, I think, was that if anybody has transcripts that I don't think you talked about that,
right,
that they want to know if they want to get a rough idea of how many credits they think they would be able to transfer in, you can feel free to email us, and we'll give you an unofficial eval, and that will let you know, a sort of a ballpark figure of how many will transfer in. You don't need to send an official transcript to us for that unofficial eval, but when you do actually apply, you'll have to send an official transcript. We have a couple of questions that came in, and I just want to
Okay.
encourage anybody to submit questions that they have while we're going to go through them. Okay, so are all HIM classes online? I'm trying to register for the fall. However, those classes do not mention web-based methods.
Yes, they are all online. When you look in well, I'm a little puzzled because unless you've already been accepted and you've had a meeting with your advisor, you shouldn't be able to register just yet. So yeah, and I don't believe it says anything about being web-based. It just says meeting place TBA, I think. But
Yeah,
yes, they're all online.
Yeah, all of our classes are online. Does CUNY SPS have a writing center, and how does it work?
Well, yes, we have several writing fellows. Their job is to help students with writing, and they can be reached either via phone call. They can be reached in person, or they can be reached via Skype or webinar. However, whatever it is that you need and the assistance that they'll need, they'll customize whatever you need so that you can work with them.
I don't see any other questions coming in. Oh, wait. Okay. How many credits do you receive for the CPC and the CCS certification?
So for the CCS certification, we give 18 credits. And for the CPC credential, we give 3 credits. So hopefully you have the CPS.
Yeah, but also if you have both, there's a
Still
little bit of
18.
overlap, so it's
Right.
still 18. Just wanted to make sure that was clear. Okay, I guess we did a pretty good job because I don't see too many questions coming in.
Well, we'll wait another minute. If anybody has any questions, feel free to pop them into the chat box there. But certainly if you have more specific questions related to yourself or your circumstance, please feel free to reach out to me, and we'll certainly be able to get back to you with an answer to your question. We had a nice group of you on the line today, so we hope we see your name in our application portal. And any other questions?
Yes, actually,
Oh,
2
okay.
people asked the same question.
Oh, okay.
How many credits do you receive for the RHIT?
Well, usually for what we do with the RHIT is we will evaluate your courses first, those that you had from your associate degree program. So, and then if there's a gap and there's something that you probably learned in one of your classes in the associate degree level. So I guess what I should say is there's a gap. We try and figure out where the gap is, and you could get additional credits for the RHIT. Chances are, though, most students get the maximum number of credits from their RHIT program transferring in and don't need to rely on any additional credits from the prior learning assessment program. Just depends on which college you're coming from, to be honest.
Right, and we do have articulation agreements with 1 or 2 colleges, and we are in the process of working on more. So you can also look at our website for that, and you would be able to see exactly how many credits would transfer in from your HIT program. Somebody's asking, they have the CCS, and would that count towards the 24 needed to apply?
Yeah, it could. So email me that, please, that question. I believe we can accommodate that.
And if we can't, we can kind of work with you about You can technically enter our medical coding certificate program, which all those credits sort of roll into the HIM program. So if you only have those 18 and not the 20, not up to the 24, you can take the courses in our medical certificate program that would count towards your HIM until you got to the 24. It's a little confusing, but if you email us, we'll explain it better.
Right.
Do we require any practicum hours at a healthcare facility?
We do have a practicum PPE at the very end of the program. It's one of the last classes that you take before graduation. But as you can tell with our student body, and what I mentioned on all the slides about students like you, we try and customize the experience as best we can with each student. So sometimes we have people, there might be some of you on the line already that are working in an HIM department already and have some of this type of experience. So it really is a customizable thing, and we work with each student individually to work it out.
Okay. Someone else from a specific school has asked about an articulation agreement. We do not have yet an articulation agreement with that school. I don't want to mention the name, but we are hoping to get a articulation agreement. But based on past students that have transferred from that school, I think we've accepted almost all of the credits. Okay. I sounded a little cryptic there, I think, but I think the person understands what I'm saying.
Okay.
Okay, I don't see any other questions. Yes, thank you, the person said, so they got what I'm saying. Okay, again, if you have any other questions that you think of, sometimes you don't think of it today, you might think of it tomorrow or the next day. Please reach out to us and drop us an email, and we'll be more than happy to answer any of the questions that you have. So I don't see any more coming in, so I think we can let everybody go for the night.
Well, thank you very much. Oh, one other thing I should mention quickly. We are currently accepting students for the fall semester, as you're probably aware. However, I don't know if anybody on the line is interested in starting in summer. We do have a summer semester. If you apply now and your application is completed and then it's reviewed and you're accepted prior to the beginning of the semester, which starts like June 3rd or 4th, I forget what the date is, as a possibility you could start and take summer classes. They are shorter. We are offering some HIM classes in a 10-week summer semester rather than a 15-week semester. So that possibility exists as well. But you could still elect to apply, and certainly your application would be considered for the fall semester. One other thing, the deadline for fall semester is for your application is, I believe, July 9th. Didn't we determine this? July 8th, July 9th, something like that. What that means is that we have to have a complete application at that time, which includes transcripts from all of your prior colleges. Usually this is the thing that's a hang up with getting a complete application. We need to get all of those completed transcripts. They all go to a centralized CUNY location for the most part. So sometimes it takes a little bit longer than one might expect. So please don't apply on July 7th or 8th, the day before the deadline, and expect that your transcripts would be there the next day. So just a word of caution, I would say start your application and think about it and apply sooner than later, just so we make sure you get a completed application before the deadline. So with that, my last minute add-on. So thanks again for joining us. We really appreciate your participation. And as we both mentioned, please feel free to reach out to us. We'd be happy to answer any questions about the CUNY School of Professional Studies, about the field of HIM, and whatever other questions you might have about the field. So thanks again, and have a good evening, and hopefully we'll see your name on our application portal, as I said before. So thanks a lot. Have a good evening.